Hi, I'm Peter Atkinson. I'm a lecturer within the Gugwandruk Indigenous Unit. I'm also Yorta Yorta with Family Connections to Wurundjeri people, and with me today is...
Hi, I'm Karen. I'm Wiradjuri and I'm the Director of the Indigenous Unit in the faculty. And we're here today to talk to you about social determinants. So, Peter, can you tell me a bit about what social determinants are?
So my understanding of social determinants are that they are the determining social processes, particularly in relation to health and well-being. And the typical social determinants that we know about from Western literature are things like housing, income, employment or unemployment, um, even social capital, so your connections to community, are some of the ways that we think about the social determinants of health.
So, if you know rich people, you might have connections to employment and other resources that they kind of move around in those circles. And if you come from an area of poverty, you might not so much of that. You might have access to other things that might not be so good to your health.
And I sort of always think about this in terms of when I was growing up, a lot of my friends had their family members or friends had businesses, so they always had part-time jobs when they were, young teenagers. And I never had a part-time job because I didn't know anybody who, in our family or our close friends who had their own business that I could go and work in after school. So yes, it's definitely generally wealthier type of people are connected better and have more opportunities to experience that stuff earlier.
So why do you think it's important for health professionals to know about social determinants?
I think health professionals sometimes can get caught in a little bit of a trap thinking about health in terms of, just illness or biology. And there's so much more that contributes to our abilities to be healthy and to be well. And most of those things actually lay outside of the health field. But we need to know about it because they impact on a patient's ability to get on that health journey. And for example, might be a mum living on the, outer suburbs in Melbourne, and she might have three or four little kids, and I know this is a typical story, and they may not, to get to an appointment in town might be a whole day's experience. It might mean packing lunches for the kids and catching two buses and a tram, and you might have a pram because you've got a little toddler, and you've got, it's a big exercise for that person to get to an appointment. Whereas if you're a little bit more fortunate, you're living in the inner suburbs, you're jumping on a tram or you're driving your car, you can pay for the parking in some of the hospitals that are just crazy. So their abilities, if you're living on those outskirts, your ability to access those things is impacted. And for a health professional, you need to know that, because the better you know your patient and their background, the better that you can understand them and support them on their journey.
It's really important to have a relationship with patients so that you understand that sort of thing, really.
Yeah. Absolutely.
And why might people not be able to see social determinants, do you think?
I think if you haven't experienced it yourself, you don't know what you don't know. Yeah. And I just think, that there are so many ways that we can learn, and there's so many things that we can learn about, but you sort of have to be open to it, but you don't know what you don't know.
It's very easy to be blind to social determinants, one, when you don't know your patient very well, but the other, as you said, if you haven't experienced yourself, it can be very hard to see because you don't know what you don't know, just as you said.
Yeah. And the only way that we can know about our patients is, like you said before, was to build those strong relationships, because they're not going to disclose all those things that are going on in the background unless you build that trusting relationship.
Yeah. Thanks, Peter. That's been a very interesting little discussion about social determinants, and we hope you've learnt something too.